Met with the doctor Wednesday. Her office she was wonderful. Her office was wonderful. They had more information. They had the rest of the test results. That's when they told me it was stage 2, grade 2. They were afraid it might have moved into my lymph nodes, so they wanted to schedule an MRI. They were going to schedule me to meet with an oncologist, and they wanted me to meet with a genetic counselor. She said most often when women get cancer before the age of 40, it has to do with your hereditary. Because of my family history, she said it sounds like you have a genetic mutation, BRCA1 or BRCA2, I believe is what it's called, and it causes breast cancer and cervical cancer early on in women. I guess it increases your chances of getting that repeatedly through your life to like 40%. So she wanted me to meet with this genetic counselor to have this test done because it would determine what kind of chemotherapy and other treatments I may have to have. She said it was hormone dependent, so one of the first things they were going to probably do was shut down my hormones so it didn't, to keep it from getting any bigger or spreading. She gave me a lot of information, which made me feel a lot better. Honestly, after I left her appointment day, I felt okay. I felt like nobody had told me that my life was in danger at this point. It looked like that they, I'm young enough, they caught it early enough, and they knew enough about, especially this genetic mutation and how to successfully treat for that, there was no threat to my mortality. So I felt okay. Still off and on annoyed and kind of in disbelief on days. Tried to go back, about my daily routine until my next doctor's appointment. I can't remember how many days after that was. Next doctor's appointment was not until the next week. So I had my MRI the next Friday on the 10th, which was like, I've never had one before that I can remember, and it was like being locked in a coffin with subwoofers all around you. It was just very loud. There was a lot of vibration. I mean, the walls, I'm not a real big person. I'm only like 5'2", 130 pounds, and the walls were like, my arms were up against the walls, and they're on my side. The front walls, like here, from your face. It's very small, so people kept asking if I was claustrophobic, and I couldn't figure out, why. I understood why they kept asking that once you get in the tube, because even when you're not claustrophobic, it kind of starts to make you, like, just weird. It's not pleasant. It's just wrong. Nobody should be in a tube. MRI only took about an hour with, dress down, dress up. And I had to put an IV and put some kind of fluorescence into your bloodstream. Helps with one of the images they did. Some people, I guess, have a reaction to it. I felt kind of weird the rest of the day, and I wasn't sure if that was being magnetized full body for 45 minutes, or if it was something, or if it was the fluid they gave you. But Thursday, I went back and met with the surgeon again. Yeah, the 13th, I met with the surgeon, met with my oncologist. It was a very big day. Day started with the genetic counselor. So of course they take blood and run it. There's only one lab in the country that does it. Normally the test is, he said $4,000 just for the test. Well, it's a big deal. He, looked me over for certain signs for other genetic things. He didn't see any. He was pretty adamant that I either had this one of these, the BRCA1 or BRCA2. He said if you don't come back positive for one of those, I'm still pretty convinced you have some kind of genetic mutation. It may be one we don't have mapped or don't have enough data on yet, but based on your hereditary information and based on your age and your healthy lifestyle, this is really the only reason you would have cancer. So again, he gave me a lot of information too. Talked about if you were positive, talking to your family and maybe having my mother and my sister tested, because it could mean things for them later on in life. My mother has already had breast cancer once, so if she's positive for this, that means she has a 45% chance of it coming back. If my sister were positive, it could mean she would have a 50% chance of passing this mutation on to her daughter. It would mean, of course, a high risk for breast cancer, ovarian cancer for her, and there's preventative steps that they can take medically if she is. So it's important for them to know if they are not, if I am. So I let them know, of course, and I guess results take 2 to 3 weeks, so I still don't know about that. Let's see. After I met with him, I met with the oncologist. I was told beforehand that she is the best. They went out of their way to get this appointment with me, with her. I'm talking to a lot of different people over the last few weeks who have gone through similar experiences or know people who have gone through cancer and dealt with oncologists. They all tell me that oncologists in general are very disconnected, very cold, very much all business, and she was. I was not a fan of her at first, but I did take away her lunch hour so she could see me. I mean, that was kind of the deal, how we could get me in to see her on time, so I wouldn't have been thrilled either. But she knew her stuff, but she, I don't know, that appointment, I was really upset after. I had felt okay. I felt like I could do this. I had felt like almost empowered by some of the doctors I had seen before because of the information they gave me, the choices they gave me. When I first met with the surgeon, she gave me options. She told me, it's big. If it stays under 5 centimeters, you have more options with your treatment. You can opt to do a lumpectomy. You can opt to do a mastectomy. We can do chemo before. We can do chemo after. You may not need chemo if we can, shrink it down with hormone stuff. There was just a lot of options, and it felt like my treatment I was in control. I had the power to choose and kind of lay out the plan. When I met with the oncologist, I felt like she was taking all of that away from me. She asked a bunch of questions. She said, no, you can't do the trial because you have seizures. And I had grand mal seizures when I was a child. I don't have them often anymore. They're related directly to my blood sugar, so I didn't think it was going to be an issue. She was very concerned about it. She said some of these medications will cause seizures in people who don't normally have them. So she said, before we do anything, before I decide what kind of treatment you can have, you have to see a neurologist and you have to have a CT scan. And she, I originally, the kind of the plan I had been coming to, the decision I had been coming to after getting all of information originally, especially if I have this genetic mutation, was to have a double mastectomy with immediate reconstruction, do chemotherapy first. That was what I had wanted to do. That was kind of the decision I had made. And she was not really thrilled with that. She was like, no, I don't, you don't get your heart set on that. You may not be able to have reconstruction until sometime later. We may have to do a heavy round of chemo first and then another round afterward, and you may have to have radiation. And I've already been told that radiation makes it more difficult to have reconstruction because of the damage it does to your skin and, the underlying connective tissue and muscle groups and stuff. So, again, I wasn't thrilled with her. That whole appointment I felt like the whole world had crumbled in on me. I felt like I could carry this burden, I could carry this load, I could get through this was possible, I could do it. After that meeting with her, it just all fell in around me, and I was just dragging through the rest of that, not the day, because I got to see my surgeon later, but for a few hours until I saw my surgeon again, I just was crushed. After meeting with the surgeon, several hours later, the surgeon had a chance to talk to the oncologist before my appointment. So when I came in, they had, everybody had kind of had a phone conference and talked about what they knew, what they thought, and what the plan was. And she made me feel better again. I felt like she put the power back in my hands and, let me decide. She said, if you want to do chemo first, we can do chemo first. She said, and depending on how the tumor reacts will determine, if you have to have another round or if you have radiation. But she had my MRI results, and she seemed pretty confident that I would only have to have the chemo first. So She thought that it would react well to the first round of chemotherapy and any other drugs they may end up giving me. The MRI showed that it is 4 centimeters. It's big, and it's right kind of on the border. Had it been 5, then my options would have been very much limited, and my treatment would have been really, really aggressive. But because it's 4, it's just kind of right, right here. And because L is grade 2, it's stage 2. It's all right in the middle. It's just right in this sweet spot where, it's not good. It's concerning. It's going to be a really rough, miserable year for the next year as I go through all this process. But I still have options. I still have some control. I still have a really positive outcome, I guess is what I want to say. So she decided we were going to make the appointment to have my port catheter put in, which is about the size of a quarter. It's a plastic rubber medical port access point they put under the skin, right below the collarbone, right about here. And it has a hose that goes right into your main artery and into your heart. And that's how they administer all the drugs that you'll be getting through the whole treatment. The surgery didn't worry me. It was the thought of having a tube and drugs going straight into my heart that makes me nauseous to even think about. It's not. They say it makes life a lot easier on you as the patient to have a port, because if they need blood, if they need to give you drugs, me having potential seizure issues with my treatment, they can give me anti-seizure medication immediately, and it'll work that much faster. Pain meds, everything. It just makes the whole process that much